Delhi University in 1987. He is a member of IMA, DMA, All India Ophthalmology Society, Delhi Ophthalmology Society. Some of the services provided by him are artificial eyes cataract surgery with microincision technique using phagoemulsification and foldable intraocular lenses. LASIK laser for spectacle removal by conventional and femtosecond laser techniques, eye exercises and fluorescent angiography, OCT and treatment of diabetic retinopathy and glaucoma using lasers, etc. He has extensive experience in all these procedures. He has a gold medal in final professional examination in MBBS in 1985. As I said, he is an alumnus of UCMS, a postgraduate from Maulana. He is director and senior eye surgeon at Global Medical Center in Vasant Vihar right now. He is registered with Delhi Medical Council and Medical Council of India. More importantly, Dr. Naveen Gupta is a regular member of Physicians Forum of India, and he is one of the surgeons, apart from Dr. Podar sir, who do not like to miss any of the CMEs being done on Wednesday by the forum, which are going to be 800 next time. Dr. Naveen is a very close friend and our regular traveling partner for the last 16 years for the PFI forums that we hold on Wednesday. He is very close to my heart. Dr. Naveen Gupta, over to you.
Thank you so much. Thank you for inviting me.
Be close to the mic.
Sir, mic का वो लाल button दबाओ. Good afternoon. Thank you for inviting me. Today we talk about preventive ophthalmology. As we know, eye care delivery involves preventive, curative and rehabilitative services. Preventive ophthalmology is also known as community ophthalmology. Preventive eye care is the provision of appropriate, accessible and affordable eye care to people as close as possible to where they live. This is to prevent the sight-threatening diseases or blinding diseases. It includes eye health education, symptom identification, visual acuity measurement and basic eye examination. As we know, vision I'll not bore you with all the details. Vision is the act of seeing. It is the sense by which objects in the environment are perceived by the light they give off or reflect. Low vision is less than 6/18 in the better eye with the best corrected visual acuity, but greater than 3/60. Blindness, as defined by WHO, is inability to see, and the best corrected visual acuity in better eye is less than 3/60. But in India, National Program of Control of Blindness defines this as less than 6/60. There are 285 million visually impaired people in the world, out of which 246 million have low vision and 39 million are blind. Slide is not moving. These are the causes of blindness, and there are primary vision centers, secondary vision centers and tertiary vision centers, which are the center of excellence, which provide and lay the standard of ophthalmic eye care in India, and they are responsible for the research. Early age screening can be done for congenital cataract, retinopathy of prematurity, refractions, amblyopia, strabismus, ocular injuries, and in adults screening can be done for refractive disorders, cataract, glaucoma, diabetic retinopathy, ARND. Now we start with congenital cataract, which is due to genetic birth defects like in Down syndrome or uterine infections like the maternal rubella. Amniocentesis is the procedure of choice to have prenatal diagnosis of these diseases. Genetic counseling is advised if there is a history of diabetes mellitus, retinitis pigmentosa, retinoblastoma or neurofibromatosis. Congenital cataract should be differentially diagnosed with retinoblastoma, It is also called leukocoria, which includes retinal detachment, ROP, endophthalmitis, sports disease, etc. Primary prevention is by genetic counseling and vaccination. Secondary prevention is by surgery. The next important is retinopathy of prematurity, which affects the immature vasculature in the eye of premature babies. If it is mild, it can cause no visual defects, but the aggressive one will cause new blood vessel formation and progress to retinal detachment and blindness. The risk factors are gestational age less than 32 weeks, low birth weight less than 2000 grams, and it is aggravated by supplementation of oxygen at birth. Primary prevention is to provide good antenatal care and neonatal care. Secondary is to examine the child at the age of 4 to 6 weeks. Tertiary is to do laser photocoagulation of cryopaxy and look for complications like retinal detachment and vitreous hemorrhage. Refractive errors could be myopia, hyperopia, or astigmatism. Primary prevention is by seeing the family history, history of injury, surgery, infections, or history of near work. Secondary is to provide optical correction by means of spectacles, lenses, or refractive surgery. Tertiary is to prevent amblyopia by patching or optical correction. Amblyopia, very important part of the childhood. Amblyopia or lazy eye is decreased vision in one eye in absence of any organic disease. This leads to lack of binocular vision and loss of stereo vision. Primary prevention is by screening for cause of visual deprivation at the age of 4 to 6 weeks, whereby we look for red reflex with a direct ophthalmoscope or external eye structure abnormalities and do pupillary examination. At the 3 to 6 months age, we can do fixation and follow test. 6 to 12 months, we can do corneal reflex test and alternate occlusion test. At the age of 3 to 4 years, cover and cover test and visual acuity test is recommended. More than 5 years, we can do refraction with prescribed glasses. The better eye is to be protected from injuries because that's the only seeing eye. Patching, medicine, prism, vision therapy and surgery is advised to stimulate the lazy eye to work again. Next important disease in the eye is the cataract. Cataract is the clouding of the eyelids and it presents as clouded blurred vision or dim vision. It is difficulty to see at night, glare and sensitivity to light is increased. People need brighter light for reading. Halos around light can be seen. Frequent changes in eyeglass prescription is seen and double vision in single eye. This is the most important sign for cataract. It could be seen in people more than 50 years of age, history of diabetes mellitus, injury, smoking and alcohol, exposure to sun. Regular eye examination is recommended and surgery is recommended when the change in vision starts to cause difficulty in everyday life. That's the point when you go for surgery. Next important is glaucoma or kala motia. Here the loss of vision without you knowing it. Symptoms lead to blindness. There is slow vision loss as in open angle glaucoma and painful blurred vision in angle closure glaucoma. Warning signs are halos around lights, red eye, loss of peripheral vision, eye pain, tunnel vision, headaches, and sometimes white cornea. Damage to optic nerve leads to blind spots. Open angle glaucoma, we give medication and surgery. For angle closure, we can do it by laser iridotomy. Next important is the diabetic retinopathy. It is seen in people who are obese and who are inactive, with high BP, with dyslipidemia. Screening should be done at the age of 40. Family history of diabetes mellitus is very important. Hypertension, dyslipidemia. One should have dilated eye examination every year. HbA1c should be maintained below 7. Blood pressure should be below 130/80. Digital fundus photography is the gold standard, where we do 7-field photography, or we can have 2 photographs with 45-degree, including disc and macula. If we see disc neovascularization or we see exudates around macula, then the laser treatment is to be done. Photocoagulation, cryoretinopexy, focal laser for macular edema, and sometimes we give intravitreal injections. Next important thing is age-related macular degeneration, which is seen in people who are more than 50 years of age. There is a loss of central field of vision. Macular degeneration leads to this, and primary cause of visual impairment is use of tobacco, genetic tendencies, arterial hypertension, or ultraviolet rays. It could be dry ARND or wet ARND, which is seen by fluorescent angiography. Dry one is difficult to treat and only low vision aids are important. Wet one can be treated by laser. There is another therapy called photodynamic therapy which can be used, and rehabilitation with low vision aids, lenses, and sometimes surgery. Diet is important. Omega-3 acid, vitamin C, E, zinc, copper, and antioxidants are recommended. Vitamin A deficiency also causes ocular damage. We will not go into the details. It leads to xerophthalmia, and which may lead to keratomalacia, which is because of deficient diet, chronic alcoholism, weight reducing diets, and certain food allergies. Significant signs are night blindness, bitter spots, lack of corneal epithelial luster. Early recognition and treatment is recommended. Eat, diet, do exercises. One has to see the eye doctor if you have blurred or double vision, pain in your eyes or pressure behind your eyeball, difficulty reading signs and books, or the loss of peripheral vision. Flashes of light or floating debris which block your vision, wavy lines when you should be seeing straight lines, and any sudden change in vision should be referred to eye surgeon. Important thing which we see nowadays is computer vision syndrome, which everybody has been talking about. It is the eye problem due to long computer use or mobile use. It causes eye irritation because of the dry eyes, itchy eyes, red eyes. There is blurred vision, headache, backache, sometimes dizziness, and vertigo. Treatment, as Dr. Vadva also said, to sit ergonomically, decrease the glare, adjust the viewing angle, and give eyes break. That is the 20-20-20 rule, which is every 20 minutes, look away at an object 20 feet away for 20 seconds. Also, blink frequently, limit the screen time, use blue light blocking glasses. That's the recommended thing. Dry eye also is one of the important things nowadays. That's all. I will not bore you with the statistics. Thank you. Keep your eyes healthy. Eat well.
Dr. Naveen, thank you for drawing our attention to some important things. There are a lot of children and especially adults also, who, you know, when they will say we have retired to bed, but they will keep on accessing their WhatsApp.
Yes, yes.
And once you were talking to me that you should not see in the blue eye.
Blue light. It's the mobile which emits the blue light which enters the dilated pupil at night when you are in the bed with a blanket over your head. It directly affects your macula. It burns your macula and sometimes this vision might not come back. So please, 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 not the children, even we do sometimes, please don't do this. It might be an irreversible damage to the eye.
The second thing that you mentioned was xerophthalmia.
Yeah.
And I know a lot of school children, these days they are not very fond of taking milk.
Yeah.
Neither are they fond of taking fruits and vegetables. All they want is pizzas and burgers. So in your own practice, do you see this condition?
Yeah, I've seen lots of people with bitot spots. These are the spots like flaky spots, fish skin kind on the temporal side of the eye. Very distinct, and because of the keratinization of the conjunctiva, these are formed, and there are bubble-like things under the conjunctiva. One has to give preventive doses of vitamin A, either intramuscularly or by oral dose.
What is the preventive dose?
Preventive dose is under the age of 1 year, we have to give 1 lakh intravitreal units by mouth or by injection, and after the age of 1 year, we have to give 2 lakh intravitreal units. This usually is combined with the measles vaccination. So the child would come to the primary health center and besides the vaccination, they'll also get the vitamin A dose.
Is it a part of the immunization program?
They have combined this with measles vaccine. 9 doses are recommended.
Is it the same, the oral thing that you give is the same thing as the injectable thing?
No.
You break the injection and you give it orally? No, it's a different thing.
Different.
They are different preparations.
Yeah.
What is the adult maintenance dose of vitamin A?
Adults is 2 lakh international units.
How frequently?
Right.
Okay. And in children? 1
It's
lakh.
1 lakh till the age of 1 year. After that, it's 2 lakhs per international unit. And it has to be divided in 9 doses along with the measles vaccine if needed.
Right. Now, you also mentioned about diabetic retinopathy.
Yeah.
So, we have to initially do a dilated retinal examination.
Initially dilated fundus examination, which has to see if disc or macula is involved, and then the digital fundus photography, which is the fluorescein angiography, is to be done to see where the leakage is and if there is a neovascularization on the disc or there are exudates seen around the macula, then the laser photocoagulation is to be done. Nowadays we have more diagnostic equipment like the OCT, that is the optical coherence tomography, which gives a very good picture of the retina behind, and it is useful in diagnosing many other retinal diseases.
How frequently after the first visit?
Yearly.
What should be the follow-up?
Yearly we recommend.
Yearly.
Okay. One has to maintain HbA1c like that's your field to less than 7.
Thank you very much, Dr. Naveen. Yeah, please go ahead.
What do you do with post-menopausal dryness? And if people prescribe artificial tears, then are you supposed to take it lifelong?
You can, like till the symptoms are there, you can take the artificial tears and they don't have many side effects.
There's no side effects?
There are not many side effects, but we can substitute our diet with vitamin B12, which is found to be very useful. And in severe cases, there is the latest treatment with cyclosporine, which I didn't want to confuse you.
Oh, thank you.
Dr. Naveen, so many eye-opening information. So it was very, very nice of you. Just a few small questions as a contractor, I won't ask many questions, sir. Firstly, sir, I know some eye drops were popular even when we were students to prevent cataract. So are they still? Is there anything?
They are still there,
yeah.
Which are what you say, the German eye drops used to be there. And
Something like that.
but the fun is, if you use those eye drops, cataract would come in 1 year. But if you don't use them, it will be after 52 weeks.
What a difference, sir. Anyway, sir,
Okay, you agree with me?
we agree, sir. We agree. रैट एंड माइस का डिफरेंस है। सर एक लास्ट छोटा सा सवाल ये है कि आजकल बड़ा पॉपुलर हो रहा है, एडवर्टीजमेंट में है ऑटो एडजस्टिंग स्पेक्स एंड एडजस्टेबल स्पेक्स। Is it a gimmick or there is something?
It's scientific. Like you can adjust the power, and at what power you see well, you take that.
नहीं, auto adjusting specs sir. आजकल आप चश्मा लगाओ अपने आप adjust कर।
नहीं, it's not like that. Auto adjusting is there is a screw at the end which changes the power, and
are they worth it?
You are focusing on a.
Are they worth it, sir?
They're worth it.
Right.
They're worth it.
Sir, last question.
Without paying doctor's fees, you get it, but that spectacle itself is very expensive.
Sir, diabetes causes cataract early.
Yeah.
Are there some medicines also for which we should be cautious to use because they may be causing cataract early?
So many medicines, steroids will cause, they will cause posterior subcapsular opacity, posterior subcapsular cataract is seen in people who use frequently steroid drops, and people who were using so much steroid in the COVID, they were getting cataract. So we have to be very, very cautious.
Just one small feedback from my side, sir. This important question. There is an anti-diabetic drug called pioglitazone. That drug should be used with great caution in diabetes because pioglitazone causes macular edema.
Yeah. Even ethambutol we are using in anti-tubercular treatment. So this scotoma and optic neuritis, but I didn't want to, that's why I skipped those slides, because it would have been too much.
You've done a wonderful job.
Sir, for one ARMD patients, two centers have reported success with stem cell therapy in the US and UK.
My friend is here who can elaborate on that. Ashish is an eminent stem cell.
Over tea break.
I would request Dr. S.K. Podar sir to felicitate.
Can I ask a question to Dr. Naveen?
Yeah.
Go ahead, Jitendra. Nice to see you, Jitendra. I didn't know you have come.
My question, Naveen, is can you prevent, can you delay the onset of nearsightedness?
Nearsightedness.
Yeah, mostly people will get, somebody will get at the age of 40, 45.
Nearsightedness supposedly is because of the inability of the lens to change its shape. As we age, like certain people will be able to read the same book till the age of 46, 47
so
years.
I'm able to read even
and you will be able to read till the age of 50, 52 because you are so young. So the lens flexibility tells the presbyopia, which is part of normal life and should not be bothered.
Can't be delayed.
It cannot.
It cannot.
There is no surgery.
No exercise, nothing.
Nothing. Only being young like you would
do it. Yeah.
Thank you, Dr. Naveen. I would request Dr. S.K. Podar sir to felicitate